The pandemic involving COVID-19 has affected so many things. And the thing about mammograms is that they can be altered in many ways to appear abnormal when they're really not. The vaccine has the ability to enlarge the lymph nodes, particularly on the side of your body where your injection is given. So some people may ask, why do enlarged lymph nodes matter for a mammogram? And the important thing to realize is that some breast cancer patients will have enlarged nodes because of the developing cancer. And so it can be very confusing to interpret the films. If you do end up having your mammogram and you have had a vaccine recently, this may affect the mammogram results, but in a benign way. In other words, it's important not to panic. The radiologist may see some increased size nodes. He may feel that this is appropriate time to just delay and do another mammogram down the road. But because of this risk, it's probably good to time your mammogram a little bit differently, at least for now. One is to get your mammogram just before your vaccine. If you wait, then it really needs to be delayed approximately 4 weeks after your last injection or your last vaccine shot. If you happen to be late on your mammogram already, and in fact you might be significantly behind on your mammograms, we would much rather you come in and get it done even if the vaccine has been given in the last few weeks. One thing I want to stress is that it's so important for patients who are eligible to go ahead and get their vaccine. And it's also very important to get the mammogram. So we don't want one to supersede the other. And what we recommend for those patients is just come on in, keep your scheduled appointment, let the technologist know that your vaccine was given on what date and in what arm so that the radiologist can keep this in mind. If you have any questions, we're here to talk. If you have an unusual situation or you have concerns, we're here to help.